So what is the real solution? Well, you'll be hearing this time and time again from the participants of the conference. A bit late, but most physicians are now realizing that there is more that we can offer our patients in addition to pharmaceutical pills and surgical procedures, that lifestyle medicine is a key part of the role we play to improve the health of our patients. And lifestyle medicine pays attention to 6 lifestyle factors: healthy nutrition, physical activity, avoiding toxins such as tobacco and alcohol, adequate stress management, sleeping well, and also maintaining healthy relationships. And it's estimated that 80% of the chronic conditions that we see in our healthcare system globally could be prevented if we were to adhere to a healthy lifestyle. And this is why individuals like myself are trying to incorporate these principles of lifestyle medicine into my everyday practice. As I say, I keep coming back to nutrition because it really is a key part of living well and long for us as humans. And the American College of Lifestyle Medicine clearly states that an eating plan centered around fruit, vegetables, whole grains, legumes, nuts and seeds is key for the treatment and reversal of chronic disease. So this is now established in medical guidelines that a plant-based diet, as much as you can go towards a plant-based diet, is key for prevention of chronic illness. So what does this look like? Well, you will all know, I'm sure, because you are well versed in this, but a whole food plant-based diet is a healthy plant-based diet or a healthy vegan diet. And you can see here that half the plate is fruits and vegetables. Here on the left, fruits and vegetables, a quarter of the plate is whole grains, so brown rice and bulgur and couscous and wholemeal bread. And then a quarter of the plate made up of plant protein, so that's beans and pulses and chickpeas and lentils and nuts and seeds, and mainly water for thirst, tea and coffee if you enjoy it, but you don't need to consume dairy, and certainly alcohol should be minimized. And what we know is that if we pay attention to these lifestyle factors, we have the chance not only to prevent chronic illness here up front, but we could also reverse chronic illness as well and use this as a form of treatment alongside other more conventional or allopathic medical interventions, because together we would be addressing the key drivers of chronic disease: the abnormal gut microbiome, the changes to the expression to our genes, which is known as epigenetic changes, and the abnormal stress we cause to our cells by eating an unhealthy diet or not doing physical activity and so forth. So I'm just going to digress a bit because I think it's really important to understand the role of diet and particularly diet in preventing chronic conditions, but also other healthy lifestyle factors. Because as I say, preventing underlying heart disease, type 2 diabetes, dementia, renal failure, and so forth will help you reduce your risk of cancer. So we have a lot of information about the health of vegans, and some of the largest studies come from the US and the UK. So we've got the Adventist Health Study 2, and we've got the EPIC Oxford study here in the UK. And about a third of participants are vegetarian or vegan. And what we've learned is that the long-term health of vegans and vegetarians is good. As you remove animal foods from your diet, you're more likely to be a healthy body weight as a vegan. As you remove animal products from the diet, you slash your risk of type 2 diabetes by 50%. Oops. Vegans, or those avoiding any animal foods, slash their risk of high blood pressure by 63% and are much more likely to have a healthy cholesterol. So this all helps reduce your risk of heart disease, type 2 diabetes, dementia. We've got a study from the Taiwanese cohort called the Sushi Health Study, which includes Buddhist volunteers, many of whom are vegetarian or vegan. And what this has shown over the years is that vegetarians have a healthy body weight, they have less risk of diabetes, low risk of fatty liver disease, gallstone disease, stroke, dementia, and importantly for society as a whole, they spend less on medical care, about 15% less than their omnivorous counterparts. So this is based on requiring less visits to the doctor's surgery and also less medication. Now, another way of looking at the impact of diet and on health is by scoring diet information using the plant-based dietary index. And you can see that the foods that are listed here in this table that make up the plant-based dietary index. And positive marks are given to healthy plant foods, which are fruits, vegetables, whole grains, nuts, tea, coffee, and vegetable oils. And also, we should recognize that unhealthy plant foods do not impact health in a good way. So unhealthy plant foods in this plant-based dietary index are given a negative mark. So fruit juice, refined grains, sugar-sweetened beverages, sweets and desserts. And all animal foods are both flesh, eggs, dairy are given negative marks. And when you look at all this data together, there's been a number of studies now. You find that people following a healthy plant-based diet, as depicted here in the middle column, have a vastly reduced risk of heart disease, type 2 diabetes, stroke, renal failure, fatty liver, and a reduced risk of early death. However, there is a word of caution here, because if your diet is full of refined grains, sugars, ultra-processed foods, even if it is plant-based, the unhealthy plant-based diet will increase your risk of a number of these chronic conditions. And it's been really interesting to review and read the data on the impact of diet and COVID-19. Right from the start, we knew that a healthy diet was going to support the immune system and probably impact our outcomes from COVID-19 infection. But here we have the data. We've got an analysis from the now famous Zoe COVID symptom app, which is run in the US and the UK and includes more than 500,000 participants that reported what they were eating and also how severe their COVID-19 infection was when they got it. And what the researchers found, and this was published back in September last year, that a healthy plant-based diet, like I described in the previous slides, reduced the risk of getting infection by 10%, but also reduced severity of the infection, if you do get it, by 40%. And they estimated that about a third of cases of COVID-19 could have been prevented if we paid attention to diet, but also if we address socioeconomic risk factors, which are really tied into our ability to access healthy diet.